Another special maneuver that we need to do with respect to inspection includes asking the patient to rise from the bed unsupported in order to detect any divarication of his recti. عم جمال استأذنك ممكن تهم براسك؟ Okay. Divarication can be seen right here. Okay, so I can detect dullness, which is elicited by the bladder, right above the umbilicus. So it would be wise to start percussing for shifting dullness above that, and I would move my hand from a transverse position to a longitudinal position, and I would move to the right side and then again on the left side, not going horizontally, but rather in a more inclined pattern.
Then you go to auscultate the cardiac base, the aorta, the first aortic area, and the pulmonary area, with comparing the intensity of the second heart sound in both areas.
In this section, I'm going to show you how to examine the distal pulses of the leg. But first, as we mentioned before, you have to greet the patient warmly, introduce yourself, and explain the examination to the patient. صباح الخير.
صباح النور.
ازيك؟
تمام الحمد لله.
أنا اسمي دكتور فادي.
أهلا وسهلا.
اسمك إيه؟
سيد محمد.
أهلا يا سيد. اسمح لي أفحص رجليك، أشوف النبض في الرجلين.
مفيش مشكلة.
شكرا. طيب اتفضل على سرير الكشف. So examining the distal pulses of the leg consists of mainly two pulses or two arteries that we're going to feel. First is the posterior tibial artery, and it lies between the medial malleolus of the leg and the heel. As we see here, this is the groove where the posterior tibial artery runs into. From the mastoid process, extending downwards in the neck, down to the clavicle and the sternum. So just anterior to the sternocleidomastoid, deep to it, and superficial to the muscle, this is called anterior group of cervical lymph nodes, and just posterior to the sternocleidomastoid muscle, and exactly in the posterior triangle of the neck, lie the posterior group of cervical lymph nodes.